Good morning all. This is Dr.Abishek MS. I'm from Manipal Hospital, Bangalore. So I am here to present my research paper on malnutrition, inflammation and atherosclerosis in patients with end-stage renal disease on maintenance hemodialysis. This is a single center experience and it is a cross-sectional study. So as we all know that the pathogenesis of cardiovascular damage to hemodialysis patient is far more complex. There are so many traditional factors as well as the non-traditional factors. All these days, we are all emphasizing on traditional risk factor. There are few, the non-traditional risk factor as well, as the malnutrition and oxidative stress and inflammation as well. So as we all know that mainly the cardiovascular damage occurs because of endothelial dysfunction, insulin resistance and increased oxidative stress. So protein energy malnutrition is very common in case of our dialysis patients, and it is most of the studies mentioned it is between around 18 to 75% in a dialysis patients. So they also proved that albumin is a powerful predictor of mortality in case of patients with end-stage renal disease, and it is a significant predictor for occurrence of de novo vascular events in this population. So systemic inflammation is very common in dialysis patient, and that can be detected by CRP as well as hsCRP level. And hsCRP is a precise objective index of inflammatory activity, and that itself it reflects the rise in IL-6, TNF alpha, and IL-1 also. A single measure of elevated serum CRP is a strong predictor of mortality, and higher levels are associated with worse outcome in case of ESRD patients. So similarly, carotid intimal medial thickness is regarded as an early sign of atherosclerosis, and it is significant if it is more than 1.1 mm. And the high resolution B mode ultrasound, the linear probe is used for this, and it is a reliable, reproducible, and non-invasive and inexpensive and easily available method. So there is a significant association between inflammatory state, atherosclerotic cardiovascular damage, and malnutrition, which is termed as MIA syndrome. And MIA syndrome is strongly associated with mortality in dialysis patients. So that forces us to just check the prevalence of malnutrition, inflammation, atherosclerosis in our dialysis patients. So the need is mainly the emergence of each of its components worsen the survival in dialysis patients. So coming to the objectives, our objectives are mainly estimate the prevalence and determine the association of atherosclerosis with inflammation and malnutrition. So the study design is a hospital-based cross-sectional study and conducted in the Tertiary Care Referral Institute, Department of Nephrology in Manipal Hospital, Bangalore, and the duration is being between May 2021 to December 22, and the patients are included who fulfill the inclusion criteria. The inclusion criteria is being the patient should be on dialysis for more than 3 months and the age should be more than 18 years. Exclusion criteria is if there is an active infection, liver disease, autoimmune disease, malignancies, and patients on dialysis for less than 3 months and age less than 18 years. We can see that, so all these exclusion factors mainly affect on generation of interleukins. So sample size is calculated based on the formula. So 100 patients were included, and those who are coming for maintenance and stable patients are included. And clinical examination as well as other parameters are recorded, and all patients underwent carotid Doppler ultrasound, and mainly the patients with all the active infection, liver and autoimmune disease avoided because of the comorbid conditions on which affect on the cytokine production basically. So the hypoalbuminemia defined if albumin is less than 4 gram DL. Nutritional status was assessed by serum albumin, and as we know that the serum albumin equals to or greater than 4 is the outcome goal for in all hemodialysis patients. So the presence of inflammation was checked by hsCRP, and hsCRP, if it is more than 0.3 milligram per DL, it was considered as a significant. And carotid artery intimal thickness was checked by ultrasound, measured on both sides at 3 points. One is at the carotid bulb and proximal common carotid artery and proximal portion of internal carotid artery. Total 6 readings were taken, and then afterwards average was taken. So if it is more than 1.1 mm, it was considered as a significant. And smoking and dyslipidemia and diabetes mellitus and hypertension, these are the definitions. And statistical method, mainly for correlation, we use the Pearson correlation coefficient, and multivariate regression analysis was used to approach to find out the predictors of atherosclerosis in our patient, and the p-value was considered significant if it is less than 0.05. So coming to the results, in our study, the males were around 57% and females were 43%, and age distribution wise, most of the patients were belong to from 40 to around 80 years, and the mean age was 61.7 years. So coming to the comorbid and behavioral aspects of dialysis, so in our patient, almost 100% were hypertensive. The second was the dyslipidemia, it's around 63%, and diabetes mellitus was 51%, and smoking was around 18%. So this is all the descriptive data of our patients. So duration is usually between 1 to around more than 6 years, and frequency of dialysis we divided twice and thrice. Vascular access, most of the patient of our patients was in AV fistula, it was around some 74%. So this is the biochemical parameters. And this is what we got. So the malnutrition, it was around 56%, inflammation was 68% and 65% in our total 100 patients. And we also categorized based on the MIS, so the score 1 to 4, and most of our patients belong to score 5 to 9. And this is a Venn diagram, this is depicting that all those patients who have all the components, malnutrition, inflammation, atherosclerosis was 41%. So this just we saw the correlation of hsCRP and albumin and carotid. As we seen clearly, this albumin and hsCRP is a negative correlation, and similarly albumin and carotid intimal thickness, whereas hsCRP and carotid intimal thickness were around positive correlation. This is the scatter plot depicting initially the weak negative correlation. There is a positive correlation between hsCRP and carotid intimal medial thickness. So this is what we multivariate association of factors predicting atherosclerosis, including hsCRP. So we can see the BMI is actually it is less in case of atherosclerosis. That's why the reverse paradox. And albumin is also on the lesser side, is a negative phase reactant, and EPO requirement is on the higher side in case of atherosclerosis patient. And even AV vascular access is definitely, it is not a AV fistula, it is a graft. So the discussion, there is definitely a high prevalence of traditional factors, that is agreed. Along with that, so non-traditional factors are very important. Other studies also found the same percentage as our study. So in our study, around 56% of patients with dialysis and maintenance hemodialysis had a low serum albumin. So coming to the conclusion actually, so along with the traditional factor, the non-traditional factors is also important. Just by seeing the malnutrition, inflammation and atherosclerosis, we can avoid the major cardiovascular damage to our dialysis patient just by bedside doing carotid intimal thickness or by just asking for albumin or hsCRP level. So we can avoid the morbidity in case of our dialysis patients. Thank you.
Yes, doctor. Some of your patients were on twice weekly dialysis, right?
Yes, yes, sir.
Did you look at the dialysis adequacy as a marker, as a factor in all these calculations?
Sir, actually it was looked at, sir, but we didn't get any statistical significance with respect to MIS, actually, between twice weekly and thrice weekly dialysis. That is because one is the sample size is less and it is a corporate hospital, so that could be the reason, sir. But we didn't get any statistical difference between twice and thrice weekly dialysis.
Just CRP level, single reading you have taken, or you have taken progressive, I mean 3-4 readings?
No, sir, actually it was single reading, sir. After ruling out all the factors which can influence on the cytokines, we took actually only single reading, sir, hsCRP.
Anyone from audience? Then we...
I am Dr. Nehru from Visakhapatnam. This is only for, not for you, this is only for the youngsters. When we are treating pre-dialysis patients, we tell the patients to restrict the protein.
Yes.
When the patient goes into dialysis, we forget to tell them to take more protein. So that is very, very important in controlling the malnutrition.
Yes,
so the nephrologist, whoever is treating, should insist that they should take high protein diet.
Yes, sir. Yes, sir. That is what we found, sir, actually. While taking the history, categorizing this MIS, we found that a lot of patients were still on low protein diet. So, and lot of patients were cachexia, lot of patients were malnourished. So that time only we understood the importance of dietitian, importance of role of dietitian, and importance of nephrologist in explaining what is the mode of change. Once the patient was introduced to dialysis, we have to change their dietary pattern and we have to advise them. So just by tackling this malnutrition, we can avoid the further complications or further cardiovascular damage in our dialysis patients.
Yeah, thank you. That was a nice